anymore, but a restaurant there that my dad would take me to hunting over in Labadee, which is not very far at all from here. So yeah, I'm headed to the Pacific Catawissa area today. I have a little miniature pony that we're going to do a pregnancy exam on it. You might ask me, well, how do you do a pregnancy exam on a mini, especially if you have seen pregnancy exams done on full-size horses? I have an ultrasound machine and we'll far enough along that ultrasound machine up her belly and check and see if there's a little hole kicking around in there. I did not get much of a chance to discuss my ultrasound machine this winter. I was kind of busy right about the time that I actually got it, and once I did have it, I spent most of the winter really practicing. This is one of those skills that I did not get much time to work with between and now that I finally have one. And there is a bit of a learning curve in figuring out how to use it. My poor horses are like shaved everywhere. I mean, there are bald spots shaved on them just about everywhere because I was practicing. And that is so job when it actually comes to looking at a client's horse and diagnosing problems. There's a very wide range of uses for that little machine. It is very useful. So, I mean, pregnancy exams are one, and I can do that indirectly, so I can put the probe down, well, in some not so fun areas and check for a baby that way. That's a great way to check for very early pregnancy, so before 30 days even. And then I can also use that for orthopedic uses, checking tendons and ligaments, and a little bit of joint space evaluation, although radiography is definitely more useful for the hard tissue components of orthopedics. The other use I have for that is internal medicine. So sometimes I'll have a horse with a cough. You can find lung abscesses. You can find inflammation in the lungs. You can find fluid in that field. And that's useful because that actually changes what as far as prognosis goes, if this is something that we can fix. And it also helps me determine what treatment course works best. And I'm not talking just a little bit of treatment course changes. I mean, like, I'm talking about, you know, for the case of the lung abscess, if I find a lung abscess in the foal, there is a very specific course of antibiotics that foal needs to be on to treat that problem. That's not something that I would ordinarily prescribe for that problem because, well, I mean, it has a very limited range of use. I have discovered cancer in the pleural space. We put the lungs on there and we find a bunch of fluid and things that are going to cause that. But one of the top things on your list when you get to that is you're thinking about cancer, and that really tells you the good prognosis, and that tells you that you either need to go to a hospital for treatment, or we need to call it. And other than cancer, maybe shipping fever too in a younger horse, and that's where I would